So thank you all for joining us today. So as some of you know, this component is part of a research project that's got an acronym called MHPSS-SET2. And that acronym means Mental Health and Psychosocial Support in Humanitarian Crises, Setting Consensus-Based Research Priorities for 2021 and 2030. And this is an initiative that's done under the auspices of the reference group, the Interagency Standing Committee reference group, and also it's funded by ELRA's R2HC program. And R2HC stands for Research for Health and Humanitarian Crises program. And I'm very lucky because that's written underneath in the logo, because I actually forgot what R2HC stood for. So for some of you who were around 10 years ago, a similar initiative was done, again, also with VITSI and also with the reference group, with the results that came out in about 2011 or 2012. This time we're doing it quite differently, and we're doing it in a more country level consultative approach. So key informants this time are very much focused on country level actors, such as yourselves, and also having expert or key informant input in a panel. But PT will explain to you the different components of the broader research approach that we're taking in the methodology later on. And you can also see that this consultation is conducted in partnership with MHPSS.net, and Ananda's kindly online for this, and also MHPSS.net helping with the broader social media outreach and component part of this research as well. So can we go to the next slide, please, PT? So the aim of this initiative is basically to update what was done 10 years ago. So it's to develop a consensus-based research agenda that supports MHPSS activities in humanitarian crises globally. And the results, initial results will come out later on this year in a couple of months, and then I think maybe a fuller paper in 2021. But crucially, the results are going to be applicable for the next kind of 10-year period, like the last ones were. So it's quite a long-term trajectory that we're looking at, particularly in humanitarian world, where kind of 6 months is sometimes viewed as a long time. We're actually looking at 10 years. And the difference this time is that we've changed the governance structure of how we're doing this whole research approach. So we have what's called a funding and a policy council, an FPAC, I think it's called, or FAPC. We're very bad with acronyms. And that Funding and Policy Council is chaired by Alistair Ager, who works with DFID, and Mark van Ommeren at the World Health Organization. And the reason why we have involved this Funding and Policy Council, which consists of around, I think it's either 15 or maybe 20. I'm looking at you PT members. I don't know, I can't remember how many in total.
It is 15 members.
15, yeah. And these are funding research bodies, basically, that support research, often in humanitarian settings, or also in more fragile or settings where there's complex political settings as well, for example. So there are a number of agencies that are grant funding bodies that are interested in this initiative. And we have included them this time, and they were not there in the first round, done 10 years ago, because we've realized that it's not just about creating the research agenda, that agenda then needs to be funded, and it needs to be put forward in future research calls. So when calls for proposals go out to universities and research institutes and humanitarian organizations, kind of MHPSS needs to be included within that funding call. So we're trying to get them on board now, involved in this process, in the hope that they will absorb the results within their own funding mechanisms, taking it forward. We also have what's called a Scientific and Practice Advisory Board, a SPAB, again, another very bad acronym, that myself co-chairs along with VITSI, who's now at the University of Copenhagen here in Denmark. And the Scientific and Practice Advisory Board has a number of members, around 25, who are recommending people to be involved in a wider panel that PT will explain to you later on the next slide. And this again is to try and leverage their contacts and their recommendations at global level, but also very much at country level, and reflecting both policymakers, but also practitioners and people from a research background. So there's a kind of quite a mixture in that 25-person group. And then the implementation of this project is being done by Health Right International, and the address is there, and that's the organization that PT works for. And then, as I said before, the funder is ELRA, and their R2HC research program. And I think that link takes you through to background information about this particular project as well. And I think, PT, are we sharing these slides with the participants later on?
Yes, the slides will be included in the kit that we'll talk about. Okay,
great. Yes. And I think it's over to you now.
Okay, great. So I'll speak a little bit about the project study methodology and then the DIY consultation component in particular, because that's what we're talking about today. So the study methodology for the project consists of 3 steps. The first step is the research generation step, number 1. Ananda, if you can move your mouse there. which actually consists of 3 components. One is a panel of about 200 or more experts in the field, and these are researchers, implementers, and policymakers who have been nominated by the Scientific and Practice Advisory Board that Sarah spoke about. And then they are answering an online questionnaire, being part of the panel to answer the question of what are the critical research questions for the field of MHPSS.net, and these are the individual-based kind of consultation that we have for the component. For this step. And then we have the DIY consultations, which is group-based, where we want to reach more of the implementers and the practitioners on the ground all over the world. So is the panel as well. But this is group-based consultation where the implementers and practitioners can do it yourself to generate the list of research questions and propose them to us. And then the third component in the first step is the qualitative study, which are basically case studies in 3 different humanitarian settings. We have selected the 3 settings to be in Lebanon, Indonesia, and Uganda, to reflect the diversity of the context and the needs for the humanitarian crises. And we are hiring the in-country research coordinators to conduct individual interviews and focus group discussions with implementers and policymakers and service users on the ground at the locality in order to get their input as well. So after the first step of research generation coming from all these 3 different sources, what happens is that we're going to go through a consolidation phase, which is being conducted at Health Right, overseen by Vista, Toll, and myself, where we will consolidate the similar themes, research questions, organize them into themes, remove duplicates if necessary, and yeah, so that's our task. And then the panel again will be engaged in step 3, where we present the consolidated list to the panel, and then they are also presented with a set of criteria where they will rank the consolidated list, rank and choose the top 20 research questions, which will then form the research priorities for the field in the next decade. Okay, next slide, please. So for the DIY consultations, this is what this component is about and the webinar is about. Basically, any 3 or more group of individuals who do belong to an organization, an entity, or a network, and these can be implementers, researchers, policymakers, even the users, service users. So people who have received at MHPSS activities or support can get together and do the DIY consultation. It lasts about 20 minutes, and we'll go over the steps later. And the consultation period is also taking place from the 10th to the 30th, so until the end of the month. Now over to you, Ananda.
Yes, thank you, PT. So there are basically 3 steps that to be followed if one wants to participate in a DIY consultation. The first one is to fill out the interest form. And this form is where we ask anyone who's interested in running one of these consultations to provide some information to us about who the target audience or participants of the consultation will be, and also information like how many people you might expect to participate. And this helps us to keep track of interest in the project, but also to follow up with whoever's organizing this to provide support and just check that you've managed to send us the outcomes of your consultation event. The second step is to set a date and time and actually conduct the session, and it is really up to the implementer or the convener to identify who would be willing to participate and schedule the consultation. But the way we're seeing it is we would ask people to plan for a minimum of 20 minutes. And of course, noting that there is the context of COVID-19, we also ask that people conduct these sessions in accordance with whatever the appropriate local or institutional procedures are regarding in-person meetings, or as an alternative, you can carry these out via phone, Zoom, or any other web-based platform if you need to. And we'll cover the details of that session next. But the third final stage in this DIY consultation is to, and this is a crucial one, is to submit the summary form. And this form contains the information that you gather during the DIY consultation, and you can send that in either by email or via the online form. And we'll provide towards the end an outline of the form that you will have to fill out. Let me just go to the next slide. Yes. Just in terms of preparing for the to do the DIY consultation, a key thing to do is to assign someone to take notes about what is said during the session to ensure that you are able to capture what is said accurately, and it facilitates your filling out the summary form. You also ideally should send participants information or share with them information about the project or this particular exercise in advance, particularly if you think it'll help them to prepare for it. And this can include the project information document that was linked to on the second slide, or even the toolkit that we will be sharing with you. Again, if the session is going to be conducted in person, you must follow all the locally mandated and preferably the WHO recommended health and safety measures to prevent and reduce the transmission of COVID-19. And of course, use virtual alternatives if that would be safer. Also, we recommend that you fill out the summary form immediately after the completion of the session. Some of the bits of the summary form can actually be done during the session itself. And doing it right after or during will make sure that the information is as accurate as possible and not to be subject to recall bias or just failures of memory, which can be very unfortunate. Right? We also would love to get photographs of the consultation session shared with us if you like. And of course, you should ask colleagues beforehand if this is something they'd be comfortable or interested in doing. And of course, get permission from anyone who appears in the photographs before sharing them with us. Let me just go to the next slide now. Great. So this is about the session itself, right? So I think at the start of the session, allow some time, maybe 5 minutes, to warm things up, get information about your group and note that down, or the work that they do if they're practitioners, or the work perhaps that you are doing with them if they're a group of service users. And this is the first section in the summary form that Pete will share with you later. And this is really important because it helps us to understand the context of the setting from which this information is coming, so that we can later draw some connections between the types of contexts from which these questions are drawn and the very questions that are being proposed, right? And the main portion of the consultation will focus on providing answers to the question, what are the most important research questions in the field of mental health and psychosocial support for the next 10 years? It's from 2021 to 2030. And we'd like to suggest that you start off by giving people some individual quiet time, about 5 minutes or so, to list their own questions. And especially for people who may not be familiar with research, you can try and explain what you're asking in terms of saying that research includes efforts to improve knowledge. We are thinking about research that's done in universities by professors or academics or students, as well as research done by people who provide services, whether that's counselors or health workers, the information that they collect. So information can also include formative assessments, or even just routine monitoring evaluation of program outcomes. And once everyone's had a chance to list their own questions, they can come back as a group and begin sharing. And that's the next part of the session, which is also a very crucial bit. And so as people share, you can note if there's similar types of questions, and you can also use certain prompts to try and elicit more comments from the participants, like asking them, what are the critical gaps in information that you have access to ensure good mental health and psychosocial support practices, or when you're trying to do your work, when you're implementing services, what kinds of knowledge do you feel is often missing? And we will have a demo video, which will be this video, also available to people who are conducting this, that they can play for themselves, or indeed for the people who are participating in the session. Of course, it'll take a bit of more of time than the 20 minutes we have budgeted for.
Okay, let me share screen now.
Sure, I'm going to stop sharing.
Can you see my screen?
Yes, we can. Yeah.
Okay, great. So the last step is basically the submitting your feedback, the responses, the research questions that you came up with. And there are two ways to do this. One is filling out the online form, which is also, which is basically a Google form. It's very similar to SurveyMonkey that you might be used to. Or you can email the summary form to our email address, MHPSS-SET2@healthright.org. And I'll go over summary forms, just to let you know how it looks like, and maybe demystify some of the questions that you might have in preparation for the consultation meeting. So here is where you will see the form. Here I can put my email address, and then that is a required section. You can see the date of the consultation, the number of participants, the type of method that you that was implemented for the session, and then the type of people who were involved. Here is a question on the type of humanitarian setting that you were involved in, so just a brief description on that. And then the type of services or activities that you provide, the organization, entity, or network. And then the next page is just basically the research questions that you generated. We have allocated up this so that you can input up to 10 research questions. If you can briefly describe or elaborate on the research questions, that would be great. If not, totally fine. But it should be hopefully understandable and explanatory from our end. And then the last, oh yeah, you must submit at least one research question. And then the last one, the last component is the option of submitting your pictures, uploading your pictures to us if you like. So this is the permission that we require to use your pictures, photographs, and names in the report, in the final report. And that is it, and you just click submit. Now, let me go back to the presentation and say, so that is actually the preferred method, because if you do the online form on our end, we don't have to do data entry. So it will help us significantly if you can do that. But we understand that you might not have access to internet, etc., to access the form. And after the session, those who have signed up with the interest form, you will be provided with the summary form that is included in the email that the person, the convener, will get. And I'll show the email right now, which is basically a mirror of the online form. Sorry, here. So after people have signed up, you can still see my outlook.
Yes.
Yes, the message. Okay, great. Here is the link to the toolkit, which is the slides that you have just seen. And then the two options to submit, and then you can see here the DIY consultation form is actually included in the email, where then you can just pull up this email on your mobile phone or your computer or laptop, and then you can type in the information and then send it back to us at MHPSS-SET2 at healthright.org.
Great.
Okay.
Thank you.